Hey, good morning, good afternoon, everybody. Welcome to the information webinar about My Child Matters, Home Away from Home by CCI. And today we're going to go through the application process, just explain what you need to do. People are joining in. We're just waiting for people to join in. While we wait for people to join in, you'll see some slides that are rotating in front of you. Please have a look. This explains the technical aspects. So if you want to ask questions, we're going to keep all the questions until the end. So please, if you want to ask questions, just make a note. We're keeping the questions to the end because probably your questions will be answered as we go along. But if you do have a question at the end, you can either click on, you see the slide there where it says at the bottom, click on the Q&A and type in your question, or you can go to the gestures and put raised hands. At the end, we'll have a good amount of time to ask questions. The session is also being translated into Spanish. So if you go to the bottom, you'll see that if you just wait for that slide, the next slide, there is a button in the bottom that you can click that says translation, and you'll get the translation. You choose your language. Okay, we'll just wait for one or two people to join before we start. Okay, I think that everyone has joined us now, so welcome, a warm welcome again. We're very excited to be launching this new project in partnership with Foundation S of Sanofi, and this project is about the supporting aspects of childhood cancer treatment. As we know, childhood cancer treatment, there is a good medical treatment, and that survival rates can be up to 80–90%. But we don't have the survival rates in low and middle income countries, mainly due to lack of resources and also to socioeconomic factors. So we really wanted to support our members on projects that offer the support services for children and adolescents with cancer to ensure that there is adherence and ultimately better survival rates. But we'll talk more about that in a minute. I first just want to introduce the working group. So there's a working group which has been planning this program and will also be the selection panelists when you submit your proposals. And there are 3 folks from CCI and 2 from Foundation S. So firstly, with Foundation S, it's my great pleasure to be working with Isabel Villadari. She is the head of childhood cancer program in Foundation S, which you'll know as My Child Matters. And then we've got Melis Boydanan. Unfortunately, she's not with us in this session, but she'll join us for the later session, and she's a project manager at Foundation S as well. On the CCI team, we have myself, Executive Director of CCI. We've got Alejandra Mendez. I think you all know Alejandra, who is a board member and also a parent and a member of Fundación Nostros Hijos. I'll say it right one day. Apologies. And we've got Ira Suletsio, who is the founder and the chair of Waikaki of Indonesia. So that's the working group team, to introduce you quickly. But next, I'm going to introduce our new CCI president. I think most of you know that João Bragança ended his term at our conference in Ottawa in October, and Rodney Wong has come on as the new president. We are very privileged to have Rodney. Rodney is has been the president of the Sarawak organization, SCCS of Indonesia for many years. He's a parent, and he's also an honorary advisor to the Childhood Cancer Foundation of Malaysia. So special welcome to you, Rodney, and over to you.
Yeah, good morning. Thank you, Carl. Good morning, good afternoon, and good evening to everyone. Greetings from CCI Global. And thank you for taking the time to attend this very important seminar. Now, when my son Keith was undergoing his leukemia treatment, I get to know another 6-year-old child. His name is Anong, and who has a relapse for his acute lymphoblastic leukemia, ALL. He actually started treatment about a year ago, and while he was having the treatment, one of the friends actually introduced him to a bomo. A bomo is like a witch doctor in Malaysia who say can cure him of ALL. The parents then brought him to see the witch doctor, who make a small cut on his wrist and squeeze out some blood. And he then told the parents that he has got rid of the leukemia blood and the kid is now cured. The parent then stopped all treatment. Unfortunately, the cancer came back very aggressively, and despite the best attempt by the medical team, including a bone marrow transplant, they couldn't save the kid. Ladies and gentlemen, abandonment is very real, and it exists not only in LMIC countries, but also in developing countries like Malaysia. This is just one of the many causes of abandonment. Others can be traveling costs, accommodation, awareness. So when my organization SCCS first put up Home Away from Home 19 years ago, we find that there was an immediate decline on abandonment. Families don't have to worry about accommodation, transports, and there's close sharing between experienced parents, counseling, new parents, and there are many more benefits that Home Away from Home can bring to the new parents. Today, we hardly have any abandonment case among the family we supported. Therefore, it is with my heartfelt gratitude and appreciation to Foundation S, and of course, Isabel Villadari, the head of Childhood Cancer Program at Foundation S, for making this important initiative possible to all our CCI communities. And this initiative will be a key enabler towards GICC goal, as any reduction of abandonment will allow us to make further progress towards raising survival rates from 40% to 60%, and thereby saving 1 million children's lives. I strongly encourage CCI member organizations to actively apply for this important grant, and CCI, together with our partner Foundation S, we will do our utmost to support you in this project. So thank you everyone for your interest to participate. And now it's my pleasure to invite Isabel Villadari, Head of Childhood Cancer Program at Foundation S, to share her thoughts with us. Isabel, please.
Hi, everybody. It's my pleasure to with you, and we, as part of the working group on this great initiative, Home Away from Home by Foundation S and Childhood Cancer International. Thank you, Rodney, and thank you, Carl, for the nice words. As a working group member, it's my pleasure to bring you to the content of this webinar so that you have the full view on what we will discuss for this request for grants today. So after this intro and this context, I and Carl will share with you the why we decided together to build this new initiative, Home Away from Home. Then after, we will deep dive on the criteria for selection so that when you will apply, you are very familiar with this, the criteria of selection. We will move to the assessment because all the project that will be submitted needs to showcase an impact. As Rodney mentioned, treatment abandonment is key for this initiative. So how your project will bring an impact and how we will assess the project, and the outcome of the project will be assessed, and the selection process. Then after, we will deep dive on the application form that you potentially already view on the website of CCI. And we will open the floor for a Q&A session before the closing of this webinar by Alejandra. So with that, I let the floor, if you can go to the next slide, I will introduce and let the floor to Carl just afterwards. So at Foundation S, why we wanted to partner and to build this initiative? You know, Foundation S is in the field of childhood cancer, if I can use that word, since 2005. With this program, this famous program, My Child Matters. And most of our activities and the team that we are supporting are pediatric oncologists, and with the goal to strengthen the healthcare system, to train healthcare professionals, to provide better care for the children. But we know that only a holistic approach is working. And what can we do outside of purely medical activities? And that's the rationale why I knock at the door of CCI to discuss, to have a conversation, and to co-build this initiative with CCI. And that's for me a very important day today to launch and to share with you how we want to move forward with this initiative. With that, I let the floor to Carl for this context on CCI standpoint. We don't hear you well. If you can.
Okay, is that better? Sorry. Okay, so CCI and its members, we have the same objectives. We know that the medical treatment and care is very important, but we know that the supporting services are needed as well. As there's a lot of research shows, as I mentioned earlier, that one of the main reasons why there isn't a good adherence to treatment and survival rates, and particularly in developing countries, is because either diagnosis doesn't occur or is very late, or there's abandonment of treatment. So we know that there's various things that we need to support the children and the families with in order to ensure that nutrition, transportation, etc., etc. But the home away from home is a very important aspect, because it means that where it is difficult for families to get treatment because the treatment centers are far away, they can do so by having a home away from home close to a treatment center, where not only is it a place to stay, but also it's a home, it's a family. It often includes transportation, emotional support, psychological support, and so forth. And we actually did, when we did our survey, the CareNet survey, which many of you participated in, we discovered that about 50%, about half and half, have home away from home. And the other 50% that don't have, it's not because you don't want to have, it's just for financial resources. So this is a way, partnering with Foundation is to provide this. Ultimately, this is to ensure increased adherence to treatment, reduction of abandonment, and ultimately to help the survival rates in LMICs. Okay, over to the next slide.
Hi, I'm very excited to be here this morning, this afternoon, or this night. We've been working for a long time in this project, and for me, it's very it's great to be here this morning and presenting and inviting all of CCI members to consider taking part of this project. I'm sure this will be a life-changing program for many children and families around the world. First, I want to start thanking Isabel and all the Foundation S team for this friendship and partnership with CCI. And first, I want to, as Carl was saying, I'm very happy that this project, I'm very sure, will ensure adherence to cancer treatment, reduce abandonment, and of course, make that our families are more engaged in this project. So we have a task force you can see us here, all of us as CCI, with the support of Foundation S, have been working and will develop and can explore and review all your applications. Of course, we want to decrease treatment abandonment and support organizations in providing a second home for the patients and the caregivers in these 5 ways. First, those of you who are interested in building a new home away from home, expand an existing parent house, rent a parent house, cover operating expenses for a set of period of time, or improve an existing parent house in your countries. We are targeting low-income countries and middle-income countries. So all of you are invited to consider and participate in this proposal. And the submissions need to be sent by January 5th. There's not too much time to go. So please consider this date, and we will accept proposals until midnight in Paris time. And with this, I will pass the word to my friend Ira for the next slide.
Thank you, Alexandra. Yes, I will be presenting the criteria for selection. And first of all, I'm honored to be in this team, a collaboration with CCI and Foundation S, and be able to share and learn things and meet the great people for doing a good cause, especially in childhood cancer. So I noticed there are many organizations already attended this, and I hope you can use or take benefit, whatever you think that you can be able to benefit this project. So yeah, I can start that the scope of this project is actually it's written for low middle income countries. We mean the LMIC is, according to the World Bank, there are 2 categories, low middle income and upper middle income. So both are okay to apply the funds. And talking about the member of CCI, it is mentioned that who has been active and in operation for a minimum 1 year, and which has already demonstrated a commitment, ability to support children and adolescents with cancer. We consider 1 year is from where we received the application, which is 1st of January. So you can also already apply. And of course, with the note that the member who has good standing. Good standing means there is no fees behind. The fees are up to date. Either way, whether you pay it in full or you waive the fee, you are eligible to attend this application. And the localization. So what we consider that it should not be more than 25 kilometers or 16 miles from the relevant healthcare services. It is because in practice, the house or the home away from home, it should be near the hospital, because due to the emergency or the transportation from the patient to the hospital, it should be more and more efficient. So you don't need to travel far to go from and to the hospital to the home away from home. And the project is mentioned that it is self-explanatory. That is the why. Give us the description of the reason why you need the house and how you need the house. You have to explain more briefly on the applications. As for the funds, the request should be between 25,000 euro up to 250,000. That is already mentioned, that you can refurbish the house, you can build a house. There are many others that you can do. So you have to make a full explanation in the applications. And of course, for the funds, it should be between 25,000 euro to 250. And of course, the more you ask, you should give more also explanations or strong argument to the proposal. It is really needed so the team can really justify on whatever proposal you have given. And the business plan, if you ask, for example, to fund to run a house or refurbish a house. You have to show that we're sustaining the house running for the next years, and it should not be dependent on CCI or Foundation F. So you really have to have a sustainability of the fund for running the house. That is very important. The funding, it is minimum of 30% of the income of the housing comes also from other donors or from local donors, or we prefer to have some local donors, but you can also have international donors. For example, if you got funding for the project for 30,000 euros, but the fund, it is not for operational. It should be only for the project. And of course, 80,000 more or less should be from other money, and it should be indicated in the budget. So you have to make sure to defer the operational cost as well as for the project itself. And the plan of action, the plan of action means is how far that you organization is doing beyond the house itself. What are other programs that you have from the organization? Because this is also help the team to justify whether you are eligible for the project. And you have, if you need more questions, you can ask at the later presentation at the end. Thank you so much. And I refer you to
Isabel.
The next, yes. Thank you. Thank you, Isabel.
Yeah, you're welcome. So for the next slide, I will spend some time on the assessment and give the floor to Carl for the selection process. So everybody around this table, all the attendees, all of you will agree that this initiative is useful. Useful is not enough. We want that this pilot initiative that we are piloting now is renewed in the future. And for that, we need to assess and we need to demonstrate how impactful was the initiative that you will submit in this request for a proposal. That is why we listed some intermediate outcomes and intermediate and immediate outcomes. Immediate outcomes are number of beneficiaries served, number of bed nights provided, number of meals provided. So that could be the same for an hotel, but our aim is to improve treatment abandonment. So we need to go to the next level. It's not an hotel only. It's also more than that. So that's why we are expecting intermediate outcome. And that's where the holistic approach came. That's where you should connect it with the medical services to see before the initiative that you will submit and after we make progress, either in the nutrition level of the children, or the well-being of the children or the family. And that's for the beneficiary, how you can measure that this initiative that you will submit through this RFP will provide an essential accommodation needs that will improve their treatment adherence. And with the treatment team, what difference they notice since the beginning of this project, or the difference in the abandonment rates, the difference, the improvement of the physical or the mental health of the children or the family, the improvement of the nutrition status, the facilitation of the treatment, all these intermediate outcomes that we know from publication that they facilitate and they improve the survival rates. How, Carl, how we will select, what will be the selection process?
Okay, thank you, Isabel. Yeah, so when the panel sits and we look at it, these are the things we're going to be looking at. So one is understanding. Do you have a good understanding of what is needed to run a home away from home, and why we do that. If you've been doing it for many years, and this is to refurbish and help with operational costs, then of course you do. So you just have to explain what your expertise are and understanding in that area. If it's new for you, it's okay that it's new if you're going to build a new house, but we want to see that you understand what is going to be required and what is the context. So the next thing we'll look at is need. Is this meeting an unmet need? Again, if it's a new house, it might be because there is no accommodation available to children and parents in the area next to the treatment center. Or if it's an existing house, you need to explain why, if you're not providing that service, there is no other way or difficult other options for parents and children to have. Then Isabel mentioned the metrics and impact. It's important right from the beginning to understand what metrics you're going to measure, what impact you're going to measure, whether it's intermediate or immediate outcomes, because we will want to know what those are at the end. So what we want to see in the proposal is that you've got a plan, how you're going to measure it, and you're clear at what are the deliverables, what are the outcomes you're going to measure. Okay. Beneficiary engagement. We would prefer, and we would give a higher score to the proposals where we can see that you've involved the beneficiaries themselves, the children, the adolescents, the parents, family members, in how you are designing and running the house. So that's that one. It's empowering of the beneficiaries. As we mentioned, this is very much addressed an inequity. So we want to know how this project will particularly help disadvantaged communities, minority communities, in other words, those who otherwise wouldn't be able to get the treatment, wouldn't be able to afford the accommodation. And then finally, as has been mentioned, financial sustainability is very important. We don't want to feel that if we fund this project for a year, it'll run for a year, and then it'll end if we don't continue funding it. So we want to know that you as an organization are financial sustainable. So there's two areas. And also, if you're no longer getting funds from CCI and Foundation, next year, are you able to continue the project? And Ira mentioned other things you need to mention in your budget to show financial sustainability. Okay, remember again, at the end we'll have time for questions. If you have any questions, please make a note. I'll go on to the next slide, which is about the form, the application form. I trust you've all either emailed Lex or you've gone onto our website, use the QR code, and you've got the application form. I just want to point out a few things quickly on it. I think most of it is self-explanatory. The first section on the guidelines is very much just a summary of everything we've said today. So you can just read that and refer to that. The part about the identification, organization information is self-explanatory. You just fill that in. The project lead, we need to know who's on your team and who's the lead. And for the lead, we need a resume, a CV, curriculum vitae. Then there's a questionnaire section which asks about eligibility. In other words, are you able to apply? You should say yes to all of these, okay? Are you from LMIC? Has the organization been in existence for at least a year and a member, et cetera, et cetera. So those you should answer yes for all of them. The next page, you go on to general information about childhood cancer in your country or the implementation area. So remember that we don't know your context, and you need to explain your context. What is the situation with regarding to the incidence of childhood cancer, provision of support services, and so forth. So we understand the context in which you're offering this accommodation project and why you're offering it, okay? Then it's going to ask you about the project overview. Just explain what it is the refurbishment, construction, who it's for, who are the beneficiaries, what is the management team, how you'll run it, etc. For the section on let me just get here quickly. For the section on assessment, have a look again at the guidelines section where it talks about the outcomes, and you need to refer to those. The more you refer to those, the better, okay? Then it talks about the different projects: building a home, refurbishment, renting, running a home operations. Obviously, you're going to choose one of them. Then what's important is you need to explain what the project is, and as much documentation as possible needs to be included. For example, if you're going to be constructing a new house, then have you got the land already? Have you bought the land? Have you got the title deed? If you've got building plans, if you can submit copies of all of these. If you're doing construction or refurbishment, have you got a contract with a contractor, building contractor? If possible, send us the copies of that. Have you done the bill of quantities and the estimates? For rental agreement, a copy of the rental agreement, preferably in English if you can, but if not, we'll make a plan. What's important for us in the rental agreement is that it's secure and that it's long-term. So all of those, explain it, and as much documentation as you can. The more documentation you're able to send us, the greater confidence we have in it, the better for you, and also in terms of the scoring. Budget, you can either use just the put it on the form there, or you can submit a separate budget as long as you answer all of the questions there. We want individual items, amounts, and again, the sustainability. What are the other matching funds you have for it? The section on the application form that says important information is basically yes, no. So you just need to answer that. And then it talks about a business plan for 3 years. So this we want to see sustainability. So we want to see two different things in terms of financials. The budget is for this project specifically. The financial sustainability is that you want to see that your home and organization, what is the financial status of that now and projected over the next 3 years. So as I mentioned earlier, we have the confidence that even if you don't receive funding from CCI and Financial Ethics in the next year or two, that you still have the financial sustainability to run the home. Let's see if there's anything else. Okay, then it also asks, remember the ultimate goal of this is adherence to treatment. So it asks what you're going to do in general to ensure adherence to treatment. And that's up to you. You might say, well, we also offer psychosocial services, or we do patient follow-up and we phone them in advance to make sure they're coming for their treatment, etc. Whatever you can put in that to show that you're doing other actions that contributes to patient adherence to treatment, that will strengthen your proposal. And then very importantly, it's an important principle that we work in partnership and collaboration with several stakeholders, but importantly, the treatment center, the hospital. So a letter of recommendation, a letter of support, something like that from the treatment center. It's preferred, but I'd almost say that it's a requirement because that's going to be a very important principle for us. And then if there's any other professional institutions, groups that you work with, you might need to be registered, for example, with the Department of Health, and then let us have a copy of that, or let us know about that. There might be psychosocial service, also a letter of support from the doctors. Any letters of support from stakeholders is most appreciated. Evaluation plan, I think we've said enough. You just need to lay it out as per the questionnaire. And then there's a question about contingency plans. What are some of the risks of this, and what will you do if that happens? For example, you need to get building permissions. What is the time frame of that, and what if that gets delayed? What are the provisional plans? And then as mentioned, the exit strategy when the grant is ended. How will you continue with running the home away from home? Okay, that is a summary of the questionnaire. I said a lot, but there is a recording of this, and you will be able to go through the questionnaire yourself in your own time. On that note, by the way, the working group here, we are available after this for questions which are for clarification or technical questions on the process, on the application process, okay? We cannot advise you in terms of the design of the project, because then we would not be objective. So you can't ask us, for example, if I include nutrition, does that strengthen my proposal? Because we can't give you advice on the design of the project, but we can give you clarify questions you have on the process. Okay, on that, I think we are running pretty much on time, and I'm going to open the floor for questions. So there are some questions that have already been placed on the Q&A. So the first question by Benson: is there a minimum number of years as CCI members entitled to application? Yes. If I understand it correctly, well, I'm not sure I understand it correctly. Is there a minimum number of years as CCI member entitled? So we will be hopefully repeating this next year. As you said, the organization has to be a member of CCI for at least a year. We are only doing applications 1 year at a time, okay? So there'll be, if you want to apply again, there'll be a extension of or renewed application, but we won't give for more than a year at this stage. Anyone else on the panel want to add to that answer? Okay. The next question: after the deadline of the application, how long the selection committee will announce the result for the applicant to plan forward? And that's a good question. So the cutoff point is 5th of January. We hope to meet soon after that. Isabel, I would think that at the end of January, you would be able to give an answer. What are your thoughts?
Yeah, our goal is to let the selected project and the one that are unfortunately not selected before the International Childhood Cancer Day, which is on, as everybody know, on the 15th of February. So we will do our best to work hard in order to give you some feedback, and the feedback end of January, beginning of February.
Okay, then the next question: is there a maximum time limit to execute a project to ensure it will run smoothly and successfully until the measure of abandonment? Okay, so the time frame is 1 year, but we do not necessarily expect that the project will be concluded in a year, but for the sake of this grant, it will be until the end of the year. We will then want a report at the beginning of the next year. But we understand, I mean, if you're building a new house, for example, that it might not be finished in December. Nonetheless, we will consider the project for that year to be closed, and we will be expecting a report early the following year. Does that answer the question? Okay. If I apply for a post-BMT home, the number of beneficiaries compared to the HAH will be lesser. What will affect our chances? Okay. Bindu, if you don't mind explaining what is BMT and the HAH. Okay, HAH I think we know, but what is BMT?
Bone marrow transplant.
Ah, okay. Thank you. Yes. Alejandro, you want to answer that one? Or someone else from the panel? I'm happy to answer it unless someone else wants to answer.
You can answer, but I think a BMT bone marrow transplant kids need a safe place to stay after the transplant. So we will consider that, and also consider if there are other similar homes in the context where those kids can stay after the bone marrow transplant.
Yeah, and look, one of the criteria is to have a greater impact with numbers, but we do understand that BMT by definition is lower numbers. So we'll consider that more on the basis of need. Okay, and we go further down.
Can I add something, Carl? Especially if there's no other similar facility in the context, that is important for us to understand that they need to have at least one safe place to stay after the transplant.
Okay. Business, can you please explain business plan? Era, you want to take that one? Or I'm happy to take it if you want me to. I'll take it. Okay. So basically, business plan means that what are your projected income and expenses, and how you will achieve that income in simple terms. So as the question is, over the next 3 years, so something to the effect that we know that our regular income is ABC, this donor, that donor, fees, whatever. And we know that our regular expenses are 1, 2, 3, 4, 5, rent, food, water, electricity, etc. We anticipate that our funding for year 2 will be X, that our expenses for year 2 will be X. So that is the business plan. So we can see you have a plan. Maybe I must say on this that if you're going to be doing refurbishment or building a house and you have other funders, it's okay if you haven't got the funding already in the bank, as long as you've got a clear commitment. So maybe a letter of commitment, a pledge, or something from a donor to say that this organization is building an extension, we know it's so much, and our company, whatever, has pledged a contribution of so many euros towards it. Okay. The next question, would priority be given to those who have not benefited yet from this program? The priority is given on a needs basis. So where we're trying to encourage, remember I mentioned at the beginning that the 50% where there aren't home away from homes, particularly in LMICs, we're trying to encourage for homes to be open or existing homes to enlarge or continue. So priority is given to those. So I guess in a way we could say yes from those who haven't benefited, but we of course are looking at supporting existing homes. Anyone want to add anything to that?
Yeah, maybe I'm not sure, Dr. Ula Farah, what is because this is a new initiative. Home Away from Home is completely a new initiative with this partnership with Childhood Cancer International and Foundation S. And if you are referring to the My Child Matters program, the My Child Matters program since 2025 since 25 is related, the RFP in the past and that will continue are dedicated to pediatric oncologists. And we do have a partnership to have nurses award as well. And this one is completely a new one with CCI that is addressing specifically to parents organization or organization and CCI members since 1 year. So it's it is a new initiative. So there is no historical, if I may say it like that. And so that would be my complimentary also. And Carl, we do have somebody, I don't know if who is raising the hand. So do you want us to unmute?
Okay, we've got 1, 2, 3, 4, 5, 6, 7. Can we finish the questions on the Q&A and then we'll go to the raising of the hand? Okay. Right, so the next question from Lana is, if the project is about to running a home, can it start in March? Yes, I think is the easy answer. We're looking at both at houses that are running already and homes that will be opening, so that's fine. Arun, during the planning and budgeting, what is the percentage of funding that can be used for employees, such as psychologists and the person running parents? We have no specific criteria on that, as long as you can justify it, and it's fine. Any other comments on that from the panel? You mentioned that CCI member must be in good standing and apply. If this is not the case, can you confirm that members still have time to pay? Yes, of course. I guess the easy answer, just pay your fees before you send in the application. But remember, particularly in countries alone, we do have the waiver option. So if you are unable to pay your fees, and you can apply for a reduction of the fee, and in fact, a lot of our members from lower middle income countries do benefit from that. And then, can we rent apartments near the treatment centers for patients under this project? If yes, is a supporting document required? Ira is our expert on the renting, so I'm going to give this question to Ira.
Renting a house, it's possible, but I'm not sure it's renting an apartment because you need to have.
Ira, can you go closer to your computer? It's very hard to hear you. Yeah.
Okay. So about renting an apartment, actually we asked whether to rent a house rather than an apartment, because that in an apartment is difficult to, how do you say, you have to have a MOU with the apartment, or if it's your own, you have to have something very clear also. Can you hear me?
It's very mixed, noisy.
Okay.
I don't know, have you got another speaker on? Maybe I can just repeat what you've said. You're on mute now.
Yes. Okay. I'll try to explain that. Can you hear me now? Can you hear me now? Okay.
Yeah, better.
Okay. Yeah. About renting an apartment, I think that should be the last resource, because we prefer to have a house instead of an apartment. Because if it is an apartment, then it depends on the house. What is the standard situation? What is the agreement based on the apartment itself? We need to have a clarification of that. And of course, the people.
Sorry, Ira.
Yeah. Sorry. Can you hear me? Can you hear me?
Okay. Maybe if I can just I think what you said is that we prefer that you rent a home rather than an apartment. I think the question here is what is in the best interest of the children, the adolescents, and the parents. And I think an apartment, there may be some questions as to that's the most suitable accommodation. So in terms of comfort and also what's the word? Keep a secluded environment for the sake of infections and so forth. That's what we'll be looking at. We're not necessarily saying it has to be a house, but I think we would have those questions with an apartment. Okay, did I capture that?
Yes.
Okay.
Yes.
Then can we rent an apartment and then buy a house later? Yes, I think that's fine, because by renting, you're going to get experience on how to run a home away from home, which will mean that when you're ready to build, you've already acquired that experience. CCI will CCI share the presentation today as diagrams and images? Yes, we will share, right? Okay. Our hospitals are in big cities and there's no land nearby to build a house. In a dense urban area, instead, we rent apartments. Okay, it's the same apartment. Does a rental apartment qualify for this grant? So there's nothing in our criteria that says you cannot rent an apartment, but we will have those same questions. And we do understand most of the treatment centers are in big cities. That's part of the problem why children and parents can't get to them. But and land are short. So and in the city centers, of course, often there aren't homes, houses, and it's more apartments. But we do need to look at, is that apartment suitable for sick children and their families, etc. So that's what you'll have to look at. So there's nothing preventing you from doing it, put it that. Okay, I think I've got, all right, there's more questions, but I think the lady person who's put up their hand very patiently, maybe we can go to them, and then I'll go back to the Q&As on the chat. Sorry, I can't see who raised their hand. If you can, someone will help me with that. The person who raised their hand earlier,
no,
raise your hand.
Sorry, nobody raised hand.
Nobody. Okay, I thought someone raised a hand. Okay, let's then continue. Okay, how many grants can CCI give out each year? So it's not determined by grants, but the amount. So we have a fixed amount we can give, and once we have allocated that amount, then that's as many as we can give. Okay. If an applicant has a plan for 2 years for building a house and run it, does the applicant just write the application for what you expect can be done within 2024 first year and reapply in the second year, or the applicant should write the whole budget for 2 years and put in year 1, 2, and 3? Actually, as per the questionnaire, we actually want you to do it for 3 years. So the budget is for year 1. Okay, so we're going to start building the house in year 1. Maybe all we're going to do is buy the land and start the construction, but we will continue in year 2, and maybe in year 3 we'll open the home and we'll run the home. So the budget you are doing for your project is for year 1, what is included in the purchase of the land and building of the land, etc. But we need to know what you're doing in year 2. That's a sustainability plan, the 3-year plan, year 2 and 3, because we need to know that you have a plan beyond just renting and building. Okay. Okay, how long can CCI support a single organization in terms of years? Isabel, I'll give it to you. I think the question is, we just give them 1 year, or are we happy to keep giving them more than 1 year?
Yeah, this is a pilot, so we will pilot for this year. How long can CCI support a single organization? The one, either it is something to demonstrate that one services is also impactful in terms of survival rate, so we can continue in order to in the future. The main idea is to, I don't know, there is a French expression to support the starting and then to find new funders in the future. So that because if you start a new activity, potentially you will not find any funder. So we support you in CCI, and Foundation S support you in demonstrating that what you are doing is improving health and survival of children, so that new donors are jumping in supporting you. So that's you should not consider that it is a given for years. You will always need it to find new donors in the future. And once you are autonomous, we would like to support newcomers. So that's the idea, the principle of this initiative, in order to initiate project, initiate experiences, so that new donors are coming in, and not fix several organizations and supporting them for many years. That will not allow us to support new teams.
Thank you, Isabel. Okay, new question. Does the selection process include the evaluation of the documents submitted, or whether there will be any direct visit to already running? Okay, so we will not be able to go and visit the home, but yes, the evaluation will include the assessment of the supporting documents. Okay, so as I said earlier, the more of those you've got, the more certainty, the better for your application. Okay, I think I've covered, did I miss any question? I think I've covered them all. If there's any other questions, if you type them in, or please feel free to raise your hand. We can unmute you if you want to ask a question verbally. We have 3 minutes left. Okay, so it's great to see some. Oh, wait, just come in. No, that's not a question. It's great to see such a good attendance and good interest in this. I'll hand over to Alejandra, who will do the close of this session for us.
Thank you, everybody, for joining us. I see there are about 40 people connected, so I'm very excited to reviewing and receiving all your submissions. As you can see, both Foundation S and CCI are totally aligned with the WCCA goal of reaching 40% of survival by the year of 2030. So we are really hoping that this proposal will help not only give a better quality of life to families and children who are undergoing cancer treatment, but also will improve the survival rates. So please, I really encourage you to consider sending your submissions. We are very excited to see that so many people was interested. We're having another seminar in a couple of hours. So we are expecting this to be a very all CCI members to participate. Thank you again, Foundation S, for this alliance. Thank you, Isabel, for this, for believing in us and giving this unique opportunity to all our CCI members. So, well, we're looking forward to receiving all your applications, and please don't hesitate in contacting us if you have more questions about the application process, as Carl mentioned. So, thank you again, and see you soon.
Everybody, all the best. If the panelists can please stay on.
No, I need to close, Carl, because there is always the attendance.
Can we log back in?
Yeah.
Okay.
We will connect in a few minutes. Thank you.
Okay, we'll rejoin. Thank you.